transmission. Whether that will happen, like I said, depends on several other factors. But suitability currently in highland areas, there isn't malaria. Used to be there maybe 100 years ago, but we've eradicated it slowly but surely. We're going to lose ground. You look at places like Bangladesh, you look at mega cities in river deltas, they're at great risk from climate change. And if you raise sea level by 1 meter here, you inundate about a quarter of the country. And then if you go to 3 meters, you inundate about a third to almost half. So this has dramatic implications for population movement there and agricultural production, other things. Unfortunately, you would think that increased CO2 levels would fertilize agriculture, promote plant growth, and we do see that with certain kinds of plants. But over time, if you include the impact of increased temperatures and look at CO2 dynamics with plants going forward, what we're likely to see is a decrease in cereal crop yields all across the world. So we're going to move a lot of our food production northward, and certain places that rely on subsistence farming currently are not going to be able to do it. And then the production that does occur probably will be less nutritious, so that'll exacerbate protein, energy malnutrition, and micronutrient deficiencies. Water scarcity is a great concern. There's a lot of glacial-fed agriculture around the world, and that's going to vanish. And as a result of this, we'll see a lot more conflict. Now, these are images from Rwanda. I did some public health work there several years ago, and they, of course, had their genocide that killed about 1 million people. And it's billed as an ethnic conflict, but in Collapse, Paradigm talks about how, in fact, this really was actually a conflict over environmental resources and land in particular. I think we're likely to see more of these going forward as resources become ever more scarce and population pressures increase. And so we'll see more conflicts that may or may not be billed as environmental conflicts, but ultimately probably are. And the thing that I want us to understand, and I think we can talk about how to respond to it, but we all have to agree, empirically, we are exporting risk from a health standpoint. And we have to make our peace with that. And what I'm here to do at some level is remind you of it and put it at the forefront of your mind, because I think it's very easy for us to flip the light switch and use lights and other things and not think about the health implications because they're deferred and they're exported. They're very far away, but they are real. And they will be experienced by your children, they'll be experienced by populations far away. So what do we do about it? Well, we recognize it, recognize our interdependence, and we articulate our position on it, which we're in the process of doing. Of course, this is difficult for us to think about. It's at the limits of what we've experienced. It's terrifying and it's sad. And it's hard. It's hard to let go of some of these habits we have that keep us dependent on fossil fuels. And there's been a lot of misinformation that's been promulgated about these issues. So we have to do a lot of corrective teaching at this point. And this is what we've done. Up to now, we've really stuck our heads in the sand and hoped it will go away. And it's clearly not going away. I put this up because this is an interesting diagram. I pulled it off the web. This is a set of suggestions for what you can do to reduce your carbon footprint. To me, it actually covers a lot of things that I think are important, but it's a little bit frenzied and frenetic, and it doesn't necessarily make you feel like your life's going to be any more coherent and organized. But it is a nice set of suggestions. It also makes it clear how significant the changes might be. If you really endorsed all of them, you really are making some significant life changes. It's going to take time for us to get here. But what I want you to understand is that the health impacts of climate change, as I've gone through and shown, are really quite significant. And the negotiations at Copenhagen they focus on temperature, they focus on sea level rise. Health has not been the primary focus of these negotiations. And here you see impacts on water, ecosystems, food, coasts, and critical infrastructure, and then health at the bottom. All of those things have impacts on health. Health, again, is where the rubber hits the road. And when we hit up to 5 degrees Celsius, those health impacts are likely to be catastrophic. So what is to be done? Well, CDC uses a framework called the Essential Public Health Services, which for those of you in public health is probably familiar. And it is a cycle that we go through for making sure that we're doing everything we're supposed to be doing to protect the public's health. And we've applied that framework to climate change. So we're increasing our surveillance around waterborne disease, tick-borne disease, and other things, both domestically and globally. We're improving laboratory capacity to look at novel diseases that may be introduced into the United States and then propagate, like West Nile. West Nile was introduced, had nothing to do with climate change, but it's climate sensitive, and the epidemic of West Nile was most likely driven at some level by environmental and climatic changes here. Speaking, teaching, working to bring together groups like you to talk about what's going on and what needs to be done. Informing policy around climate change and the health impacts of energy changes, other things. And then preparing the public health workforce, so going out and teaching and investing in the next generation of public health leaders. And of course, doing research to further clarify the health impacts of climate change. I'm not going to go through this here. This is the stabilization wedges that have been proposed for reducing our emissions. And if we had more time, I would go through them. They have to do with increased efficiency and then shifting to other energy sources. We can talk more about that afterwards. But one of the last points I want to leave you with is that these interventions have co-benefits. They're also health related. So if you decrease the amount of your reliance on a car to get around and you walk and bike and other things, it improves your cardiovascular health. It also decreases emissions and so improves other people's cardiovascular health. You eat locally grown food, there are decreased transport costs, you're promoting local agriculture, most likely decreased pesticide use, and increased energy efficiency. You may have some upfront costs that are significant, but over long haul, it's quite cost effective. And there are business opportunities for all of these things that the rest of the world is already taking advantage of. So I think that we need to be in a competitive position to take advantage of this stuff. So I want to leave you with the thought that environmental policy is health policy ultimately. These things have significant health impacts. And we're reaching the edge of our carrying capacity globally. So we're seeing these health impacts more readily all the time. It's an important frame. And if we intervene and we think about health, we can really realize some significant health benefits. So I want to thank you again for your time. Thanks for inviting me here. And I look forward to hearing from the rest of the speakers.
Thank you very much, Jeremy. You've given us a lot to think about, and a great introduction to the topic. I failed to mention at the beginning, I appreciate the sponsorship of the groups that have sponsored this event today: the Natural Resources Defense Council, the National Wildlife Federation, and Clean Energy Works. Appreciate their sponsorship so that we can get this good introduction. Next up is Dr. Kim Knowlton.
Thank you all so much for being here. Good afternoon. Good afternoon. Oh, I like that. As Jeremy said, I like that interactive welcome. But thank you all really sincerely for being here. Between the public health, the environmental expertise, and your interest in this subject, I mean, it's absolutely vital that we're here in this discussion. Thank you to the organizers, to Representative Celeste for bringing us all together, because, as Dr. Hess said, it's really important that health is at the front of this issue now and moving it forward, because I think with all the impacts that he detailed and that we in our work are seeing and are learning about just more and more all the time, it's absolutely vital that we keep moving this discussion together. So, forward together. So while I get my talk up here, let me just tell you that I work at the Natural Resources Defense Council, which is a national not-for-profit organization made up of scientists like myself. I'm a health scientist. There's also attorneys and other environmental specialists. We represent 1.3 million members and online activists. We were started in 1970, and we're all about advocating for and protecting public health and the environment and wild places. So my work really concentrates on the whole range of health impacts associated with climate change. And as a health scientist, I am really deeply concerned about this tremendous range of health impacts, many of which Dr. Hess detailed that are associated with climate change. And I want to take, building on his talk and zoom